It's so important because I need to be able to care for my patients, and there's lots of needs that are out there, and the only way to be aware of those needs are to continue to be educated and to learn what our needs are of our patients and how the needs are changing and how our demographics are changing and respectively their needs, and maybe we need to learn more about what we can do to anticipate their needs. It makes a huge difference. It makes me more competent to care for them. Absolutely. They need someone that knows what's going on, and they need someone to know that can anticipate their needs, someone that knows what they need, and to be able to answer their questions, and I need to be competent to do that.
I've always maintained education, and over the years I have a pocket full of diplomas and certificates: mental health, geriatrics, palliative care, leadership, nursing unit administration course, which is really old. If you've heard of it, you've been around for a long time. And for instance, I'm just learning now to be a PIC inserter. So it's absolutely important to keep it going and keep learning. You can learn by reading stuff, by paying attention. Well, because things always change. Our treatments always change. There's always changes. There's new medications. And sometimes it might just strengthen something that we already know also. That we keep abreast of information so they get the best possible care.
Well, nursing, like anything, is always changing. With the advent of technology that goes on and is changing weekly, monthly, yearly, nurses have to be on top of that. And we are a profession, so we have to be responsible to the patients whose lives we look after. We have to be current. We have to be aware of the legal ramifications of what we do. And when we come to the table with a good sound knowledge base, we are experienced, we are confident, and we're committed to the best care for our patients. Well, I think for the patient and their families, they can come into this hospital environment knowing and feeling confident that those people who are handling and looking after their lives are on the cutting edge of the most recent findings and education that's out there, and we are responsible for the care that we give our patients. It's both legal and it's also something that our standards of nursing hold to the highest degree. We are a licensed body. So we have to be responsible to that license, and by continuing to upgrade and seek education, we're sticking true, and we have the trust of the public who put their lives in our hands.
It is so important because, of course, our education is changing. There is new best practice procedures. There is new evidence out there. We need to stay up to date on everything that has changed for the best interests of our patients. Absolutely. I just finished my certification exam in rehabilitation. Wow. So for myself, that has been my most important piece of education after I've graduated thus far. But with stroke education and competency, there's a lot of education out there, and it's important to be part of the stroke education conferences and just to learn those best practice procedures. I think that's important for the patients that way I'm able to display best practice in my workplace and share those results and that evidence with my coworkers. I think is most important.
I think it brings people to a new level of education, and it also provides better patient care for our patients because you do have that increased level of knowledge. I believe higher education leads to better patient outcomes, and it has been well documented in the literature that people that continuing education at whatever level, patient outcomes are improved.
It's very important for their day-to-day work. Competencies We spend a lot of time here in the center talking about competencies, developing them, and talking about our recertification process, what that looks like for our RNs and all of our staff as they move forward, to make sure that they're at the level that they need to be at to maintain that competency and to develop new ones as they come along.
Also supports the scope of practice,
It does.
that full scope. Excellent question. It makes all the difference for patients. Yeah, nurses that are competent and that are operating to their full scope of practice, they are coming from a base or a foundation that's based upon research. And so it's not about just like what I would like to do for the patient. It's well researched, and we know the evidence is there. But we all know that the evidence that we rely on today has the best outcomes for the patient. And that's basically what we're here for anyway.
Well, it's part and parcel of being a nurse, right? The minute you're qualified, you're automatically starting ongoing education. You know, you have to be responsible for yourself. I mean, certainly educators have a role, and we have a continuing education role. But yourself as a registered nurse, you have to own the fact that you're responsible for your own professional development. You're responsible for reading those journal articles. You're responsible for initiating, going to your manager, going to your resource people and saying, okay, I am lacking this and I need this. How can I go about getting that? So I can get it either through articles, through going on the internet, or I can go to my educator and maybe they can assist me if I can't find something. As registered nurses, we are professionally accountable for our practice, and it is our responsibility to research, information, and ongoing education is huge. We have to be responsible for it. And there are standards of practice and competencies out there for registered nurses right now, and we have to maintain that standard of practice. So to maintain it, we have to maintain our education, and we have to seek educational opportunities to maintain that.
As I was going through my own program, I learned so much, and I remember saying to my sister after I completed my NP exam, I'll never have to probably write a test again, but I'll be learning forever. The things change so often in healthcare and in people and diagnostics that if we're not able to keep up with the pace, we're going to fall behind. Therefore, patients will be put at risk. And if we're not keeping up with everyone else, there's going to be a disadvantage to all the patients and to the population of PEI and of Canada as a whole. I wouldn't even be able to say how much learning I've done in this past since I finished my program in August. I learn every single day different ways to either interact with patients, how to treat them, how to care for them, and how to provide appropriate health promotion for them. I think it allows the patients to know that the nurses are on top of their game at all times, that we're always continuing learning, that if there is a new method to do something or a new treatment plan, that we are aware of it, and if we do, that the patients will get better care and hopefully lead a healthier life.
Oh, it's very important because nursing is changing all the time, and there's always new skills, new knowledge that you need, whether it's related to just a piece of equipment that we may use, or just to know what update services, and with different policies and procedures you have to be aware, because under your scope of practice, and you have to follow policies and procedures and how you were taught, and things do change over time. Things definitely aren't the same now as they were 20 years ago when I first graduated. I think nowadays the patient is more involved in their care, and they are definitely more aware of what is out there as well. So in part that's why we have to be up to date on what is going on and allow them to take part in their treatment and discharge.
think it's crucial because it's an evolving profession. Like every year things are changing and new research is coming out, and it's our responsibility as registered nurses to be up on that education and really maintaining that the quality of care and those standards of practice that we all value. So I think that that's really crucial and very important for us to all keep up on those new articles and research and things that are ultimately all for the betterment of healthcare and the patients that we care for. We have like the proactive education on how to be on top of things and how to educate our patients so that maybe they don't have another exacerbation of their COPD if they continue taking their puffers, and all of those things are really important to educate them before they go home. And I think when we spend time with patients, we kind of learn what the needs are and where there's gaps and where more research is needed. And so I find you witness nurses kind of taking it upon themselves to look things up and to get themselves educated on something that maybe they haven't seen a lot of. Or I see that a lot actually in critical care. If say we haven't done say there hasn't been something for a long time like a cardioversion or some type of big skill, then I always see nurses going and making sure that they're up to par and have a really good grasp on what they're doing. And as a new grad, it's very uplifting to see that, because it's just a good skill and a good segue into my whole career and what I need to be doing and my responsibility, because as a registered nurse it is my responsibility to be kind of up to par and knowledgeable and competent in the services that I deliver and be safe and caring and all those things. So
I enjoy helping people and to learn and to increase the standards of care and the standards of practice and research and best practice guidelines, and to continuously move that forward for the patient and families. So I can do that with all levels of nursing, with the ward clerks, with the LPNs, with the RNs, and now we have PCWs and orderlies too in the past. So I just really enjoy, I think it makes a big impact on what actually happens with the patient and the families whenever you have nurses that are providing good standard of care.
I really think that is important in our profession because, you know, every day, every month, there's reports coming out with regards to how to treat patients, appropriate care, and it's always changing. Basically, it makes sure that we're providing safe, clinical, evidence-based clinical care. Basically, you know, we're capable of providing them the safest, the best care that we can provide based on the newest education. And the more we increase our competence, the better nursing care we're going to be able to provide.
Well, as we were talking about evidence-based practice, it keeps getting updated, right? So what's the best evidence today might not necessarily be the best evidence 2 months down the road or 2 weeks down the road or tomorrow, right? There might be new research out there saying that actually we should be taking this route. So we do have to keep learning. We do have to keep searching for what's the best way to deal with these patients and with their illnesses and whatever's going on with them, and how to best manage that.